Thank you, Madam Chair. Madam Chair, I'm pleased to introduce Dr. Bruce Kauk, MD. He's a fellow Missourian from Gladstone. Dr. Kauk has been in private practice with Northland Internal Medicine in Gladstone since 1979. He's board certified in internal medicine and geriatrics. A graduate of the University of Nebraska Medical Center in Omaha, Dr. Kauk served his internship and residency at Southern Illinois University in Springfield. Dr. Kauk has been president of the Clay County Medical Society and president of the North Kansas City Hospital Medical Staff Credentials Committee, and he's a founding member and chairman of Clay County Senior Services in Gladstone. Thanks, Doctor, for coming in from all the way from Missouri.
Good morning. Thank you. Madam Chairman, Ranking Member Graves, members of the committee, I appreciate this opportunity to talk to you. I do not represent any society or any other specialty group. I think I come to give you the passion and the soul of what we all do every day, which is not quite the flavor of what my other colleagues have told you. They're more concerned with facts, and there are other issues to this issue. I'm particularly glad to come to this committee because most physicians traditionally have been small businessmen. One of the issues is, though, that we're seeing that change dramatically. In my community, we're down to about a 50-50 mix of internal medicine and family practice being self-employed. Most of them have joined some organization. Again, I say I'm a traditional internist. That means I do everything. I go to the hospital, I have an office practice, I have a nursing home practice. Recently, because of some of the budget issues, I've added a long-term acute care practice. So I know you're all aware that physicians are an evolution and internists are an evolution particularly. We have hospitalists, we have people who just do office work, we have people who do none of that, who don't practice active care. There are many things that physicians can do now. So there are many other opportunities competing for active practice. Again, I think it's important to focus that we traditionally have been businessmen, that we employ 4 to 5 people per practice. We pay taxes, we pay insurance for those people. For a 2-man practice, my health insurance costs for my employees are $72,000 a year. I bring evidence to you that this shortage has been going on since the 1950s, when my retired partner got a call after the funeral of one of his patients saying, "One of your patients died. Can I come to your practice?" So that brings us to the shortage. I think we all agree there is a shortage. I'm happy to hear that in all parts of medicine, but particularly primary care. Why has that happened? I think there are a number of factors: the evolution, the competition, other venues, the number of hours worked. I'd give you mine, but you wouldn't believe them. Quality of life becomes an extremely important issue for all of us. We look at comparison to medical peers. That's been talked about. The difference between primary care and such specialty reimbursement is $3.5 million over your working lifetime. You look at comparison of my neighbors. They all work a 40-hour week. I work a 60-hour week, and then I'm on call. I'm responsible every minute 80 hours. That's a great difference in quality of life. Then we wonder why people don't want to go into medicine, don't want to go into primary care. On top of that, we're asking people in primary care to do a great deal of gatekeeping. I have to personally sign numerous documents allowing other people to be paid. This takes approximately 30 minutes every day. I have to employ one full-time employee to take care of medicine issues, pre-authorizations with insurance companies. A study has been done that shows each primary care physician expends $60,000 to deal with these kind of issues. That's 1/3 of my salary. It cost me 1% of my salary to come here today on my own dime. So how do we fix that? What do we do about it? We've said that physician extenders haven't been helpful. They go on into subspecialties. We're working on equalizing reimbursement, but the budget is an issue. How do we retain present physicians? One of the things is decreasing costs. Primary care can do that. They've been shown to do that. Maintaining quality, again, primary care has been shown to do that. There are multiple studies documenting that those communities with more primary care physicians have a longer lifespan, fewer readmissions, all the things that increase costs. Prevention is another major issue in our society and our country. I listened to Tommy Thompson, previous Health and Human Services Secretary, some 10 to 12 years ago, say we're missing the boat. We've got to do preventative care. Well, we're still missing the boat. There's a lot of work to be done there, and from my point of view, that's the major area where cost savings can be entertained.
Dr. Kauk.